This is my video entry for the diagnosis of the problem. I've chosen osteoporosis as my disease. So we're going to go a little bit about what it is, how it works, how it affects the body, what treatments are around, and risk factors. So we're going to go through all that sort of stuff. So first of all, what is osteoporosis? It's a degenerative disease. They often call it the silent disease because people actually are affected by it without even knowing. It occurs when bones lose minerals faster than they can replenish them. So as the body leaches minerals and vitamins out of the bones, they become degenerated. Now, what tends to happen, so what I've got here is, if you can see it, is a picture of two long bones, picture this being the femur. So a healthy bone in that sort of end plate is going to have a lot of spongy tissue. A spongy bone, that spongy bone is going to be quite dense still. So you'll find that even though it is spongy, has those sort of small holes in it, it's going to be still quite dense and very, very strong. What tends to happen as we sort of go through osteopenia, which is kind of the first stages of osteoporosis, and then further into osteoporosis, is the bone density starts to change. So you almost think of it like a violet crumble, that honeycomb sort of look. As you sort of get degenerated, the sort of gaps and holes and density of that bone starts to become less and less. So at that point, you lose that sort of density. It becomes very easy, very frail, very easy just to snap and break. So when we have forces or just even walking, having that load of the body go through the femur, have a lot of breaks and a lot of forces that cause those breaks really easily. So if someone who's elderly and has osteoporosis falls down just at the ground, it's very common for them to break an arm, leg, that sort of thing. It's kind of that bad at this point in time that every 5 to 6 minutes an osteoporotic fracture is admitted to hospital, and they reckon by the year 2021 that it will be down to about 3 to 4 minutes. So it's pretty taxing on the health system. The main areas that they tend to occur, and it can occur in any bone, it doesn't have to be a long bone, just generally your long bones are kind of more in the structure of the sockets. From what I've researched, the femur seems to be one of the most common. Radius and ulnar pretty common as well with falls, but the femur's a pretty big one. But yeah, hip, spine, wrist, ribs, pelvis, upper arm. Generally with the spine, as it degenerates, you start to go into more of a sort of almost like a dowager's hump. You start to see them sort of slouch and hunch over a lot more. The bones or the sort of vertebrae between each other start to corrode away and then go on more of an anterior shift, and then you get that sort of curvature of the spine. So it starts to develop in all your bones. So the risk factors are generally, they reckon anyone the age of, or sort of 1 in 3 women over the age of 40 is going to develop symptoms of osteoporosis. Risk factors, if you actually look at exactly what happens in the body, lack of resistance to exercise, and lack of calcium vitamin D. So if we look at how osteoporosis occurs, it occurs when bones lose minerals being especially calcium, vitamin D, faster than it can replace them. So if you're leaching those minerals, you're going to find that it's very difficult to maintain bone density, as well as not performing resistance exercise. So for the body to lay down new bone and create or give it more density, which is called an osteoblast, that needs a stimulus upon the bone. So because tendons attach muscle to bone, by applying force through the muscle, which applies force on the tendon, which applies force on the bone, puts that stress on the bone, which then the body responds to that, create an osteoblast, which can therefore create more density in the bone tissue, or the bone cell. So simply put, poor nutrition and health are one of the main factors of osteoporosis. There are some other cases whether the person has been through leukemia treatment, like cancer treatment, things that have just taken a lot out of the body. If their digestive health isn't so great, for whatever reason, they're not able to actually absorb the calcium out of foods. Lots of those little things can accumulate. There's other factors like smoking, alcohol consumption that all contribute to getting osteoporosis. At the end of the day though, you can, and studies have shown, you can reverse the osteoporosis symptoms. So even if your bone has started to go through stages of osteopenia, you started to degrade and getting into this less dense, brittle bone, by applying force and resistance to your body, you can start to, and changing your diet of course, you can start to get osteoblasts applied to that area, which then starts to create more of a dense bone on that area. So simply put, treatment, there is medications. Obviously the downside to medications is side effects. It's got to get processed through the liver. Reading through a lot of the medications, they're all designed, or most of them are designed to prevent the further loss of any minerals out of the body. At the end of the day, I've read some case studies and it doesn't seem to prevent it 100%. It does slow it down considerably though. However, rather than just slowing it down, we'd want to reverse it. The other medications can be, there's needles that you can get with different treatments. Problem being, a lot of these are invasive, they can have a lot of side effects. Every treatment or every medication had a possible side effect related to it. Just by, and the biggest sort of change that they've sort of treated out to most people is lifestyle change. So the cool thing about lifestyle change is not only are you going to start to decrease the risk of getting osteoporosis and reversing the effects of the disease, you're actually going to have no side effects. Well, the only side effects you're going to have, you're going to start to look better as well. So treatment's pretty simple, starting eating well, and also applying resistance exercise, whether it's to do with your body weight, whether it's to do with weights, in any form, is a great way to fix that. So that's pretty much my report on osteoporosis, what it is, how it affects people, what actually happens in the bone tissue, risk factors and treatment. Hope you enjoyed listening to my lecture.